Okay, thank you, Mr. Jaffrey. And thank you all for attending, and thank you to the Institute for including me. I'm very sorry to be delayed. I ran into a technical problem here. But let's just jump right in. And I want to begin by saying that this is a complex topic that we can and should be spending days on. My goal in this brief presentation is to give you a sense of what is possible in the area of stress and health management in the workplace setting. You should have received also a 12-page handout that gives more details about the slides that we will be viewing. And also, you should have received 2 articles that I've written that will add to your understanding as well of the whole area of stress and health in the workplace. So let's move on to the objectives for this webinar. They're on page 1 of the handout, and we seem to be out of order here. The seminar objectives that we'll be following is, first of all, to give you an idea of how much control individuals have, each of us, over our health and stress. We have a lot more control than we sometimes may imagine. Secondly, I would like to have you understand how to, what it takes to cope better, both with unexpected changes, which is one kind of stress, and with the everyday pressures in life, which is another kind of stress. And finally, I will give you the means to plan a practical action plan, to develop a practical action plan for improving health and stress management. This will have to be done by you after the webinar. You will have the worksheet at the end of the handout materials. So let's first now take a look at what stress is and why too much stress is a health risk. This is handout page number 2. Where there are more details, but the basic idea is that there are 2 systems that automatically keep you in a normal sense of balance. The endocrine gland system, which is, we're mostly concerned with the thyroid gland, pituitary gland, and adrenal gland, and the autonomic nervous system, which automatically sends electrical signals to various parts of the body. These 2 systems together keep us in normal balance. But when we experience something as stressful, then the same 2 systems will create a new balance, which is preparing us to either fight or flight, fight or run away. Now, this is a primitive prehistoric response that we have not moved beyond in our biology to the ancient threats of Stone Age times, if you will. So the attack of a wild animal, or the somebody from the neighboring cave or the neighboring village comes and tries to steal your food. So you're ready to fight them or run away. And the problem becomes, in our current society, fighting in the workplace is not good, and neither is running down the hallway screaming. So the stress gets bottled up inside of us, and the holding this pressure in drains our resilience, or it eventually drains our ability to respond. So on the handout on page 2, number 9 introduces also a biological reason why this is so. It's a relatively new research finding that on the end of each chromosome, on the tip of a chromosome, there's a substance called telomeres. It's a little bit like the plastic end of a shoelace. The telomeres are created and maintained by an enzyme that we produce in our bodies called telomerase. And if we're under stress and holding the stress in, the telomeres start to get shorter. And as the telomeres get shorter, our life expectancy gets shorter and our health risk goes up dramatically. So what we need to do is protect these little endings on each chromosome. So in addition to other things like tendency towards heart disease or tendency towards cancer or tendency towards arthritis, we have to also be aware that we are doing damage to these telomeres, which are very essential to our long-term health. So this is the biological basis and the biological reason why it's important to understand health and stress. If we could now go to the next slide. This is old, well-established research, the health risk curve, where it shows that as pressure is from left to right on this diagram. As the pressure increases, your health risks go down, and then they go back up. And at the same time, your performance possibilities with increasing pressure go up and then back down. So if to the left of the dotted line, I call that rust out. Sometimes clerical staff and administrative assistants, people in repetitive jobs, they don't have enough stress to be at peak performance. And then the second dotted line on the right is the entry into burnout, which I think we've all heard of, which is too much pressure. So what we want to do is keep ourselves between the dotted lines, and that's what stress management is all about. The 5 items in the blue area, self-management is about taking care of our health with healthy lifestyle choices. Novelty management is managing the surprise and unfamiliarity aspects of changes. Habit management is addressing the everyday pressures. Performance management is identifying our own unique individual peak performance qualities and making sure those are built into our everyday work. And then life management is having a clear sense of purpose and direction. So these are all important to staying between the dotted lines rather than falling outside of them and having difficulties. In my workshops, I ask people, how do you know when you are outside the dotted lines? And the answers I get back are things like I become angry easily, or I can't sleep, or I eat too much, or I don't eat at all. I lose my temper, I lose my patience. One thing that is almost never mentioned about too much stress, about being outside the dotted line, is just the simple idea of sighing, of just taking a deep breath and letting it out. And that is the first signal that the stress is too much, and that means that the health risk is increasing and the performance possibility is decreasing. So more mistakes, more accidents, more workplace injuries, overlooked priorities, and slowing down on urgent tasks and so on. But sighing, I hope that translates to everybody's language, sighing is the earliest signal, and almost nobody ever mentions that as how they know when they've got too much. So if you have a lot of sighing in your workplace, then that's an indication the workplace is maybe not at its peak, and people may be at some risk for illness. And in your own selves, if you're working on a project late in the evening and trying to get something ready for the next morning, or the end of the quarter is coming, and there's a lot of business work to take care of, you may find yourself sighing. And the important thing here is not to just sit there and sigh and keep working, because that's not as productive as it could be. It's best to take a 10-minute break and walk someplace, or walk up and down a flight of stairs, take some deep breaths, and then come back to the task. And you'll find that your head is much clearer. And this is true of everybody in the workplace, that if you hear a lot of sighing, that's the #1 giveaway. There is a questionnaire in your materials that you again can fill out after the workshop, after our webinar is completed. It's on page 7 of the handout materials, and this is a very excellent measure of stress-related health risks. It's a measure of how much have you depleted your reserves? Or sometimes the current language, at least in the US, is how much have you lost your resilience? And it's important on this questionnaire to remember two things. One is of the 26, on each of the 26 items, how often have they been true for you in the last 2 weeks only? So your score will change rapidly with changing conditions. So only reflect back on 2 weeks when you answer the questionnaire. And the second little strange bit of the questionnaire is that if you score an item number 1, that means it never happened. So 1 is equal to 0 in this case. And you give yourself a score between 1 and 5. How often is each of the 26 items true for me? And add up your score. A score of 50 or greater indicates the onset of health risk. So answer the questionnaire honestly after the webinar is over. See what your score is. If it's above 50, then there are some stress management, lifestyle management, perhaps steps that need to be taken. It's a very accurate measure, so even though it's a simple questionnaire. So please fill this out on your own after the webinar and see how you do with that. So let's go on to the next slide, which is at the bottom of also handout page 3. This is indicates that there are 4 different categories of sources of stress. There is stress in the workplace, which we all know about. And there's also stress in the home or in the community away from the workplace. In the United States right now, a lot of people are feeling stress outside of work because of our social, political situation here. But I'll focus now just only on the workplace stress, employment stress. And I mentioned earlier there are 2 kinds of stress. There are changes that happen, and we need to be able to handle these changes. The intensity of a change stress is a function of how much surprise is created and how much unfamiliarity or uncertainty is created. So the bigger the surprise, like a sudden earthquake, or in our country right now in California where I live, living near a forest fire, that's an event that creates a lot of uncertainty and a lot of stress. The most frequent, or some of the examples that are given in the measures that I use in my workshops, the surveys, the most frequent sources of employment stress are things like job loss, getting a new boss who is very different from the previous boss, having a project canceled that I was working in very busily, a major reorganization that puts me in with new people. These are some of the things that happen frequently in the workplace that cause people change stress. On the chronic type of stress, the conditions, these are like fixed costs in accounting. The acute changes are like variable costs, and the chronic stressors, the everyday conditions, are like the fixed costs, if you understand accounting. So the chronic conditions that are often mentioned are these days, especially job security due to the increases of technology, artificial intelligence, and so on, making jobs go away or changing the nature of work, making it less challenging for the human input. One that's almost always on the list is too much to do and too little time to do it in. Just a work pressure of too many things on my agenda. Unclear expectations is another frequent everyday concern, and prolonged conflicts that haven't been resolved between workers or between units. Many organizations end up with silos between functions, and it's very difficult for a process to move across the organization horizontally between departments. And the conflicts between functions or different priorities between functions can be a chronic everyday source of stress. So there are many things, both in the change area and in the chronic area, that can cause people to begin sighing and then to become irritable and have stress and so on, as we talked about earlier. So I'd like to now look at a framework for responding to stress at work. this is on page 4 of the handouts. And the basic messages here are how can we help people, and how can the organization avoid the avoidable stressors. Find that there are a lot of things going on in the workplace that are, or a lot of habits that individuals bring to work that are avoidable or removable, but they're causing stress because they're there. Poor time management would be an example of the individual stress problem that that can be removed or avoided by learning how to manage time more effectively, or sometimes coaching executives to communicate in a different way to remove or avoid the stress they may be creating for others. In the organization, one example would be full information flow, so that people know what to expect and they have clarity about the standards and the policies that that they are expected to follow. In the immediate response area, one example for individuals would be to increase their problem-solving skills. So how do I cope with stress? Learning time management, again, would be one skill. Learning to communicate effectively would be another skill. Learning to focus on priorities, learning problem solving. These would all be good individual skills depending on the need. The organization can respond by offering employee appropriate skill training. On the bottom, the building individual capacity area, this is the third main message. We want to avoid the avoidable, we want to cope well with the unavoidables, and we want to build capacity to, or resilience to withstand the pressure. Areas here include for the individuals nutrition, exercise, relaxation, good quality relationships, and on the organization side, management style. So I have a group exercise that I do in my workshops where I have subgroups actually brainstorm and fill in what they think are the most important responses in each of those 6 cells. And then we have a discussion and we generate a single workshop list. And out of that list, we create a set of recommendations for management, or recommendations for the organization that will increase productivity and reduce stress levels in the environment. I find that this feedback loop is very important, that it's not just a workshop off in the corner of the company someplace or off in a retreat center, but there is a feedback loop back into how the organization operates. If this kind of organizational effectiveness loop is present, there's a lot higher impact of the stress management seminars than if there is none. So let's now move on to the next level. This is based on some research that I did many years ago and have updated from time to time. It addresses the normal adjustment cycle to high novelty change. Remember, high novelty is how much surprise, how much unfamiliarity or uncertainty is created by the change. So a big reorganization, a complex reorganization that is, say, for example, implementing a new database system globally that's changing how people all around the world in a multinational company are handling the data flows. When it's first announced, it may be incomprehensible and people won't be able to understand it, and there's a loss of focus for a while. Then there's a kind of a minimization or denial that the change is going to be of any difficulty. The vertical axis in this curve, by the way, is emotional outlook, from very positive at the top to very negative at the bottom. So after a minimization doesn't work, people tend to slide into what we call the pit, which is where people become angry or depressed or withdraw. And if you're familiar with Elizabeth Kubler-Ross's research in the 60s, she and I were doing our research at the same time. The big difference was her research subjects were dying of a terminal illness, and my research subjects were living and going on about their business. So the first few stages are identical to Elizabeth Kubler-Ross's stages of denial, I forget the actual names, but they go through the same stage. There's a depression and bargaining and so on, and then a letting go and a facing reality and gradually accepting the reality. And it's the same here. At the very bottom of the pit on the curve is a very critical point. It's the letting go of the past point. Prior to that, the person going through the change is looking backwards at the past and trying to hold on to the past, and is responding in a reactive kind of way about loss of the old job or the old boss or the old procedure or the old spouse at home or the healthy state before I became ill. Whatever the big change is, they're holding on or looking back at the past. It's like walking backwards into the future. At the letting go point, there's a dramatic shift when it finally happens, that the person turns around and faces the future and becomes much more proactive, and they begin to take charge of their recovery or their adaptation to the big change. And you can think about this even in something as simple as writing with a pencil and having the lead break. First there's a disbelief, then there's a little flash of upset because I have to find a new pencil, and then there's picking up a new pencil and getting on with it. The testing stage is about trying out new things. So as people move, and people move at different paces, it's important to note here. So we can't do this lockstep, but as people move beyond begin looking more positively towards whatever the future state is, they will begin testing and trying things and becoming more familiar with the new. Then they move into the search for meaning stage, learning from experience and having that learning become important. And then at integration, they move on. But by that time, usually another curve has started with another change. So I think it's important to understand at a high level, at least, how people react to a change. It's telling people they should be over it by now, or they should not feel that way doesn't help. People take different amounts of time, as I mentioned, about going through the process, and it may be that some individuals that get stuck in the pit may need some additional coaching or some help of some kind in a very big change, or maybe they just need to be given some very small step-by-step guidance rather than just the statement of we need to move on, get over it. But eventually people do tend to turn the corner and start to become more positive about every change. I know in the case of my spouse, she was a physician for 30 years in a very big healthcare system in San Francisco, and when they moved to a new building, a new major medical center building from the old building, which was damaged in an earthquake in 1989, they built a brand new building and moved in, and they also integrated their technology so that across the entire system of the whole state of California, this particular healthcare system has an entirely integrated digital medical record system, so that I can go to any of the hospitals anywhere in California and they have all my medical records right on the screen as soon as I check in. And that the combination of moving to a new building and having this technology integration introduced caused the physicians to be very upset and very cynical and very sarcastic for a while. And now it would be, they would consider it to be horrible if you told them they had to go back to paper medical records and they had to move into a more inferior building. But the initial adjustment, even to positive things and even to very effective things, takes a little time. So I'd like to move along now to the next slide, which is about the overall health risk factors that are present in life in general. These are statistics from the U.S. Centers for Disease Control about public health in the U.S. and where the risks are This is on page 6 of your handouts with more information under it about what's in play here, what are the risk factors. But you see that biology only accounts for 18% of our health risk. Your heredity, for example, the genes that you have, and so on. Only about 18% of your health risks are due to the environmental aspects of toxins like smog and pollution and bad water and so on. Actually, 10% is caused by the doctors themselves. It's called iatrogenic illness, and it's by mistreatment or failure to follow up or medical mistakes. But unfortunately, 10% of our health risks are caused by the healthcare system itself. So we want to try to avoid that if we can, as much as possible. And that's where the big 54% comes in, which is lifestyle. How effectively is a person managing their health? And because the lifestyle area also, as well as reducing risk, is building resilience. The kinds of things that are risk factors are smoking and alcohol and poor driving habits and being overweight, not doing any exercise, not eating a good diet. So in summary, the more healthy our lifestyle choices are, the better able we are to avoid illness and to handle our stress. And that's why this particular slide is more important. And I'd like to follow this up by going into some of these risk factor areas and asking you to do a quick exercise here in the webinar. Think about these 7 areas of habits. This is on handout page 8 as well as on the slides. These 7 habits are the most powerful, according to public health research, in protecting your health. So please think about yes or no answers on each of the 7. Smoking, do you smoke or not? Alcohol use, do you limit your alcohol use to a maximum of about 55 grams a day of alcohol? That's about 2 drinks, 2 glasses of wine, 2 beers, 2 mixed drinks. So there's about 50 to 55 grams of alcohol. That should be your max. Yes or no? Sufficient sleep, do you get 7 or 8 hours a night? Some people vary a little bit from that, but there's a lot of current research that is showing that the amount of sleep we get should be 7 hours to 8 hours, no matter who we are or no matter what we say about our sleep. Number 4, yes or no, do you get regular balanced meals and avoid junk food? That's the things wrapped in cellophane or aluminum foil that are cheap and can be bought at the airport or the train station or in the grocery store near the checkout lines. So don't eat candy too much, or don't eat other junk foods that are high in sugar and saturated fat. The nutritional module in my workshops boils down to 3 lessons. Number 1 is to eat real food, actual food that's not been processed very much. Eat mostly plants, fruits and vegetables and grains and so on, and don't eat too much. So eat real food, eat mostly plants, and not too much. Separate from the balanced diet is breakfast every day, which is very important in the research. Having a good balanced breakfast, it's maybe the most important meal of the day. So you give yourself yes or no on that. Maintain recommended weight. Number 6, very important here. Overweight gives us a lot of added risk factors for heart disease, for cancer, and for a lot of other illnesses. And it makes our cardiovascular system is already taxed by pumping blood into fat areas where there's not as many blood vessels. So your heart is already working overtime, and then stress causes more high blood pressure and so on as well. So it's an additive risk factor. And then 7, vigorous regular exercise. At a minimum, taking a good strenuous walk 3 to 5 times a week for about half an hour is a sort of a minimum of regular vigorous exercise. So if you've given yourself a yes or a no on each of these items, let's now go to the bottom of that worksheet page, or the next slide. This was a study that was done in Alameda County, California, which is in the San Francisco Bay Area. And this particular diagram gives us our life expectancy beyond age 45. So the 7,000 people that were studied were found that if they had 0 to 3 yeses on the previous little questionnaire, men had a life expectancy of only 21.6 more years. In other words, they would pass away at about age 66 or 67. Women do a little better, 28.6 years, so they would live into about 73 or 74 average if they have 0 to 3 yeses. 6 or 7 yeses, men would live to about the age of 78 on average, and women would live to about the age of 80 or 81 on average. So half of the people would have passed away, and half would still be alive at those ages. So this is a fairly significant, although very simple looking finding, how much some very simple life habits can affect our life expectancy, as well as affecting how effectively we can handle our everyday stress. More recent research has added 2 additional factors that have health relationships and life expectancy relationships. One is positive relationships. The more positive, good, solid relationships we have, both at work and away from work, the better able we are to handle stress, and the better our health is likely to be. And then the ninth factor, positive psychological outlook, is also protective. People who have an optimistic, I can do this kind of outlook on life tend to be more healthy and better stress managers than people who are kind of negative and don't think anything is possible and don't like anything new and so on. So the 7 habits on the previous little questionnaire, plus positive relationships and positive outlook, are 9 lifestyle factors that are very important. They make up the bulk of that 54%. And they also, if you have getting a lot of these 9 factors are in your life, then you handle stress a lot better as well. So the last slide I want to look at is page 9 in the handout. Page 9 in the handout is an introduction to relaxation. I will teach several different relaxation techniques in workshops. Different people respond better to different kinds of relaxations. There is one particular easy to follow relaxation technique that is given on page 9 in the handout. And I might mention that when stress triggers the autonomic nervous system to create fight or flight response, the relaxation response triggers the normalizing. It reverses that stress response coming from the autonomic part of your brain, or the automatic part of your brain. So your brain's, when you relax regularly, the brain sends out different signals to your body than when you're under stress and are not relaxing. So this present slide is on handout page 10. It's a reason why it's difficult. It shows why it's difficult to adopt a new habit. If you come to a workshop and you're not aware of your present limitation or liability, that's box number 1. The workshop may make you aware, and you may make a commitment to changing some of your lifestyle habits or some of your work habits to improve your stress levels and your health prospects. And by the end of the workshop, you have moved to box number 3. You're practicing a new capability or committed to doing that. However, establishing a new habit is challenging. It's not just a matter of deciding to do it. It takes a lot of new repetitions. So it's very easy to, after the workshop is over, to slide back to box number 1. And what I've given you a second article that you have received is about successful habit change. The first 8 qualities are for successful individual habit change. The entire 12 entire 12 success factors are also necessary for successful organizational change. So when you move to your after the webinar is over, on page 12 of the handout, there's an action plan that I use in the workshop, which you could fill out if you have some ideas about improving your health and stress from what we've talked about. I use this worksheet in my workshops, and I really encourage people, after they've identified all the things that they should be doing differently, to pick only one thing at a time and to pursue that one thing vigorously until it is ingrained as a new habit. So one at a time, with using the first 8 success factors in the article and there's a worksheet also that's in the handouts that's drawn from that article, to practice a new habit until it becomes unconscious. Maybe in other seminars and workshops, you've been asked by the leader or the instructor or the speaker to fold your arms. And then once everybody has their arms folded, the speaker will say, fold your arms with the other arm on top. And how does the second way feel? Well, people say it feels awkward, it feels unnatural, and yet there's no difference whether we fold our arms with the left in front of the right or the right in front of the left. But we have a habit of doing it only one way. So if you find that it's healthier to fold your arms the other way, you would have to practice this new arm folding way regularly in order for it to become automatic. And that's the challenge of adopting a new stress management habit. Or it's also the challenge of changing the culture or changing a procedure in the workplace. So that article may be very helpful to you in thinking about changes in the workplace. I focus on these ideas quite a lot in my teaching because I know how difficult it is to establish a new habit when we've had so much more practice sometimes for many years with the old unhealthy habit. So that is the end of the presentation I wanted to make, and let me turn it now back to Mr. Jaffrey to handle questions.
Well, thank you very much, Professor, for a very, very interesting presentation, and I'm glad we connected and it went pretty good. So let me go to a question box, but folks, we're open for question and answers. If you have any questions, you could either insert into the question box, or you could equally raise your hand. There's a hand icon available on the console. Please click on it if you would like to speak directly with the professor. There are a couple of questions already in the box, being the first one. How's your stress and health management approach different from others, Professor?
I have not encountered any other approaches which integrate fully the individual health qualities that we've talked about and the organizational dynamics of leadership and management style and the culture of the organization. So my original training was in organization behavior and organization effectiveness, organization development, and then in the early 1970s I began developing this approach to stress, and I don't know of other people who are integrating as completely the health aspects with the organizational dynamics. Also, another thing is that I have done pre and post research, or I've had it done on my work. I don't know of anybody else who has done anything in their stress work other than give a satisfaction questionnaire at the end of the seminar, which is important for the instructors learning about their teaching style, but it doesn't assess at all how effectively the people will use what was presented. So I've done research on collecting data on people, both biological data and also stress level data and personal habit data. And then 6 months after the workshop, I do another assessment of the same items to find out how much change has continued over 6 months based on the workshop.
Thank you very much, Professor. There's another one. How much does employee stress cost organizations every year?
That's a very difficult one to assess because a lot of the information is confidential. of individuals. We don't know all about what they're doing, but estimates have been made, at least in the U.S., that the average cost per year per employee is $3,000 or $4,000. Of lost productivity or accidents or illness and absenteeism. So several $1,000s at least. And if an employee leaves the workplace because of stress or any other reason, actually, to replace an employee at a mid to upper level position usually costs about the pay package of that person for 1 year. So that gets quite expensive as well, especially at senior levels. If somebody has a heart attack and can't return to work, or they leave because they don't like the stressful environment, the recruiting and the training and the learning curve and all these things add up to about the cost of the annual salary just to get a new person up and running.
All right, thank you very much. Another one from Tradisi Halalmart. The question is, how to create the stress-free working environment or office, Professor?
I don't think we want the stress-free environment because of rust out from that early slide. But we do want to, there it is. We do want to keep people between the dotted lines. There's plenty of research that shows that we need to have the appropriate amount of pressure in the work environment, not too much and not too little. So it really is not about getting rid of stress, but about helping people stay between the dotted lines. And the 5 management practices here are for the individual, taking care of their health, managing the changes. The habit management is about the everyday stressors, but also leaders in the organization can make sure that I have 4 words I use about how they're implementing the things that they need to implement. The leaders need to be visible, vocal, consistent, and persistent in their presentation. So full communications about things. Some of the stresses that people have in the workplace are about not knowing quite what the standards are in the new procedure, or not understanding the importance of a priority deadline, or not being able to distinguish between 2 things they've been told are top priority, or things of that nature. So how we manage people, I think, is very important to the environment, and also encouraging people to build their resilience, to build their ability to withstand the pressure, and even just to acknowledge that this is a stressful place to work, and it's important that we all manage our stress well. And maybe there's some things that can be offered to the people, confidential counseling perhaps, stress management seminars for sure, with that feedback loop, so that management has an opportunity to adjust to the things that may be unnecessarily causing stress. As fast as the high-tech world is changing, the big change I think that's happened over the last 20 or 30 years is that instead of the senior executives and the C-suite being able to say, this is what we're going to do because we want to do it this way, they're now saying, oh my God, there's all this pressure coming from rapidly changing technology. The marketplace is changing so fast. There's so much ambiguity. New competitors appear overnight. Different countries are evolving and becoming more powerful. Other countries are declining and becoming less powerful. So the external environment is changing. So more and more, the changes that are required are coming from outside the organization. And so we all need to be paying attention to this and learning on our own, and also helping others to learn how to be nimble, how to be able to as one of my colleagues says, surf on the wave of change rather than being engulfed by the waves of change. So I think management development programs that include a stress awareness, executive coaching that includes stress awareness, These are all important things because the environment we find ourselves working in becomes more turbulent rather than less turbulent as time passes.
Thank you. Thank you very much, Professor. That really brings us towards the end of the webinar. Any quick concluding remarks that you would like to give before we dismiss our Professor?
Well, again, I apologize for having my technical problem at the beginning. The system wasn't letting me log in. I hope I provided some useful ideas to people, and I would be glad to follow up to answer questions if there are some. And I've enjoyed it, and I hope that the people taking part have also gotten a few nuggets that they can make use of.
No, thank you very much once again. I really want to thank you on behalf of the Madinah Institute for Leadership and Entrepreneurship for taking the time to deliver this live webinar through our platform. So once again, Professor, thank you very much indeed for your time.
Thank you.
Thank you very much. And thank you all of those who participated in this webinar. Please stay tuned to webinar.mile.org to learn about our upcoming programs, or equally to access the recorded versions. So with that note, I would like to end and conclude. So you all have a good day, good afternoon, good evening, wherever you're calling from. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much.